that's going to discuss this extremely important topic, which is looking at the relationship between wash and nutrition, improved wash and nutrition, and also going to discuss what convergent actions can be taken to improve the nutrition outcomes through better wash. The webinar is being co-hosted by 4 organizations. There's India Sanitation Coalition, UNICEF, WaterAid India, IRC, and the India chapter of the Sustainable Sanitation Alliance, SuSanA. I'm Nitya Jacob, and I coordinate the India chapter of SuSanA, the Sustainable Sanitation Alliance. So I'd like to thank the organizers, Mitali and Sanjeev, and for helping to put this together, and Chaitali also from India Sanitation Coalition. So the webinar, the topic of the webinar has been under discussion for a little while, and we felt that it's extremely important to look at the kind of points of linkage between wash programs on one hand and nutrition programs on the other hand, and see what are the points of convergence between government and development actors, the work that the government and development actors are doing in this space to try and come out with a few policy or programmatic recommendations that could be made also. So we pulled together a group of speakers. 2 of them are from public health backgrounds, and 1 of them is from wash background. And the idea is to sort of hear from both sides and then try and present some kind of way forward, which could be convergent actions. So there are 3 objectives to the webinar. One, of course, is to understand what the correlations are between improved levels of sanitation and hygiene and health and nutrition. And then what are the reasons for adoption of good hygiene practices or the lack thereof, even in the midst of the COVID-19 pandemic. And we all know that one of the key preventive actions that people have been recommending, the government, the WHO, and all the other UNICEF and all the other agencies have been recommending, has been hand washing. And one of the key hygiene practices in wash also is good hand washing with soap. The second objective of the webinar is to collate and consolidate evidence for the relatedness and interdependence of vital health and nutritional indicators with those of wash. And then the third objective is to work out how to disseminate these the findings from the webinar, and that should be aimed at promoting good hygiene practices within the government and development partners, and also keep the COVID pandemic in mind as an opportunity to promote good sanitation and hygiene. We have 3 prominent speakers at the moment, and Dr. Rajesh Kumar, our 4th speaker, will hopefully join us in a little while. I'll introduce them now, and then maybe we can hand over to them to speak. The first speaker is Dr. Kalyan Ashish Das, who is a practicing pediatrician, and he has extensive public health experience. He's worked with various international and national organizations in public health and wash. Dr. Benazir Patil is the Chief Executive Officer of School for Development, and she's also worked with several international organizations on public health programs. Sujoy Majumdar is the Senior Wash Specialist with UNICEF India. He was formerly the director with the department and then later on the Ministry of Drinking Water and Sanitation. He was formerly director of the National Rural Drinking Water Program and the Nirbhar Bharat Abhiyan, as well as the first phase of Swachh Bharat Mission. And Dr. Rajesh Kumar is the Executive Director of the State Health Systems Resource Center in the Department of Health and Family Welfare for the Government of Punjab. So just to say a few words about the background to the webinar. We are aware that poor sanitation is one of the leading factors of diarrheal disease. And there is a very close link between diarrheal disease and malnutrition that has been well established. The impact and sustainability of hygiene improvement interventions, however, are less well studied than those of interventions in the areas of sanitation and drinking water supply. Although improved hygiene behaviors have been shown to have a significant beneficial impact on the incidence of diarrhea and other diseases. The World Health Organization estimates that 50% of malnutrition is associated with repeated diarrhea or intestinal worm infections from unsafe water or poor sanitation and hygiene. These and repeated diarrheal episodes cause intestinal enteropathy, which affect the body's ability to absorb nutrients and lead to malnutrition. There have been systematic reviews that suggest that improved sanitation can reduce the rates of diarrheal disease by as much as 32% to 37%. While many of the studies have not rigorously disaggregated the specific effects of sanitation from the overall effects of water and overall effects of wash, there are a few studies, such as one in Brazil, which has found that increasing sewerage coverage up to 80% resulted in a 22% reduction of diarrhea prevalence in children under 3 years of age. So that is one conclusive piece of evidence. So in India, there have been a few studies, and they have also kind of found that while there is a correlation between diarrhea and improved wash, the authors have interpreted that increased latrine coverage is believed to be effective for reducing the exposure to fecal pathogens. However, the results show that the outcome cannot be assumed. As efforts to improve sanitation are being undertaken worldwide, approaches should not only meet coverage targets, but should also be implemented in a way that achieves uptake, and reduces exposure to fecal pathogens. For child health, including morbidity and nutritional indicators to be influenced by sanitation programs, it is important to secure an ODF environment, which is a big plank of the second phase of Swachh Bharat mission, where there is no fecal contamination of the surface water and surface soil. And that will only be achieved through coverage, access, and usage, as well as the safe disposal of fecal waste. So I think these are some points that we could keep in mind while we are having our discussions in the webinar. And I would like to now turn it over to Dr. Ashish Kumar Das, and he has a presentation. I would like to invite him to speak. Dr. Das, kindly take over. And, just a word of housekeeping. We will invite questions from participants. Please put your questions in the chat box. After each speaker, we will look at the questions in the chat box for that particular speaker. And if there are some questions that haven't been answered, we will we'll take them up at the end after all the speakers have presented. So over to you, Dr. Das.
Yeah, thank you. Thanks a lot for giving me this opportunity to be interacting on this very crucial time where we are all talking about sanitation and connection with sanitation and nutrition, because during these COVID times, we know that how things have changed, both for the nutrition for under 5 children and for the adolescent also. So there is a very strong correlation which you have already explained as far as this nutrition is concerned with that of the water and sanitation and hygiene. We know how diarrhea has got a direct impact. Being a pediatrician, we all daily come across the diarrheal diseases, more so during the monsoon seasons, because there is a contamination of the drinking water supply. There is a hygiene issues during this time. and we see a surge in the diarrheal cases. We see a surge in different type of intestinal diseases. And what I wanted to emphasize upon is one of that of the worm infestations, because these neglected tropical diseases, the NTDs, which are directly related to the water and sanitation, the safe drinking water and sewage systems, because of this problem of contamination from the sewage, contamination from the waste disposal, the proper not being there. So there is a lot of worm infestation which is happening, and because of this neglected tropical diseases, we do not talk about much the soil helminths, that these are roundworms, tapeworms, hookworms, which are main reasons for the worm infestations and leading to the malnutrition. So one of the leading causes of malnutrition are worm infestations, which is secondary to the diarrheal cases and all these things, and leading to severe undernutrition, and thus there is a huge chance of stunting and wasting. So we see there is a direct correlation, which has a lot of studies have shown that improvement in the water and sanitation hygiene, the overall, not only the safe drinking water, but also the sanitation facilities, also the sewage facilities, the contamination which is to be prevented, the clean environment in the vicinity, and hygiene practices. If we club together, if we cannot do it in isolations, if it has to be clubbed together, then only we can achieve the results. Because even if what you said, that 80% of your sanitation facilities will only lead to 22% of the diarrheal diseases. Similarly, only safe drinking water will not help it. It's a combination. It's a holistic approach which has to be made to achieve this nutritional impact. And so the nutritional impact can only be achieved when we have a holistic approach of water, sanitation, and hygiene, and soil, and also the health impact, which has to be connected together. So when we talk about worm infestation, we know that the neglected tropical diseases, we have the deworming days, and what we are today talking about, this health and nutrition connection with the WASH, is a right appropriate time, because 10th of August is a national deworming day, because we all celebrate two national deworming days, that is the 10th of February and 10th of August. So I think in the next 4 days we are going to have a national deworming day. And now being the Anganwadis are closed, the schools are closed, so the deworming is which was used to be happening in the Anganwadis and the schools are not happening. So now I believe that many governments are doing door-to-door campaigns and home visits by the different ANMs and Anganwadi workers to do a deworming. And this deworming is very important at the same time when we talk about water and sanitation. What is happening, what we see is that during the deworming day, we are only talking about the medicines. We are only talking about the deworming of the children. But I think at the same time, we need to talk about the sanitation issues. We need to talk about the hygiene issues. And today, when we see the urban context, there is a good sewage systems which we see in urban context. But if I talk about, no one discusses about this the dog feces. And we see how the littering of the dogs are happening. We know that the dog feces has got a very high amount of worms in that, and which can lead to various diseases. Not only the worms infestation in the form of hookworms or the ascariasis, roundworms, which also causes some kidney diseases, which a lot of studies have shown. So we need to also when we are talking about WASH, we also talk about the pet how to manage the pets in our home, and the protocols has to be, guidelines has to be there, how to keep those defecations in place. The second important thing which is seen in the urban areas is that of the sewage system. When we see that how the sewage and water contamination, drinking water, because both the pipelines go side by side, the type of motor pumps which are being used, and the pressure gradients are leading to a lot of contaminations across the drinking waters which is happening. So I do not know how the government is taking it up, but this is one of the very important points which has to be seen, that the sewage contamination of the drinking water is happening repeatedly in various smaller pockets in different parts of the city. At least I see in Delhi, and I have seen it in many different places. At the same time, when we see about the rural areas, we are talking about the ODF. When we are talking about ODF, the type of latrines which we are creating. Ultimately, if you see the overall the context, the social cultural context, but we have seen that people, even after all those toilets being constructed, we are not able to achieve the complete ODF. And the reason being that the sewage systems are not being developed, and because it's a time-consuming factors. I believe that we are going into this concept of pit latrines these other type of latrines, which ultimately leads to someone has to pick those toilets later on, maybe after 10 years, maybe after 15 years. And because of the caste cultures and all those things, there is a huge issue with those type of things. I think that there is a need for even for not only urban areas, but for the rural areas also, the sewage system has to be created. And we have seen a lot of studies which are showing that the connection between the stunting, the height, which is there in under 5, not only in under 5, but also in the adolescents, the worm infestation is very severe. We may be pushing it for the under 5 children of child mortality and under 5 stunting, but I think we have to see into consideration that the growth spurts happens in the adolescent period, and the worm infestations has got a huge amount of impact on the stunting as far as the adolescent period is concerned. So I believe that during this period, these worm infestations can only be prevented. The soil helminths can only be prevented, but not only by deworming on a 6-monthly basis, but also to give them the understanding of the safe drinking water. What is the understanding of safe drinking water? Of course, the understanding of the clean environment, where we talk about this feces of the pets. We talk about all those issues which can be clubbed together, and the sewage systems and has to be done. At the same now, with the current COVID situation, which we have seen now with the new COVID coming up, the hygiene has become the foremost importance. So, everyone understands now hygiene, talk about hygiene, but no one understands how the hygiene has to be maintained, because hand hygiene, everyone uses this, because every day I see patients coming to my clinic, and also in the public health aspects, which we see that we all talk about sanitization or hand sanitization, but nobody talks about the 20 seconds of hand sanitization, or 40 seconds with soap, or with the 20 seconds with this sanitation alcohol has to be used. But people are just using for 5 seconds, and then they feel that the COVID virus is gone. I think this is something which is to be seen very, very seriously. And why it is not happening? Because I believe the only one thing is that eyes cannot see what mind doesn't know. So mind has to be told that how the hygiene has to be maintained, what is the time limit which is required for this hand washing, because 40 seconds with soap on all those 5 to 7 steps of hand washing. But if not, at least with the current scenario of using a lot of sanitation or this alcohol based sanitation products, so those needs 20 seconds for any virus, or the coronavirus or the COVID virus, COVID-19 virus to be killed. So we are not using it. We see that we are just as if they are just touching those sanitary things, and then wiping it off and feeling that everything is okay. So, and with the masking concept, because that is also related to hand hygiene, because the use of mask properly, I see every day the people coming up with wearing the mask, but regularly touching their mask with their hands. And this regular touching of the mask with the hands on the front side leads to the contamination, and is a definite cause of spreading of the disease. So it is an appeal to everybody that when we talk about hand hygiene, just saying that safe distance, a mask, wearing a mask, and by using some soap and water will not work. We have to tell them the proper how this you have to the cleanliness of the hand is important, how the cleanliness of the hand has to be done, how long it is to be used, because it has to be used for 20 seconds, rub across for all the different parts of the hands, and not to use hand to mouth, because most of the diseases are waterborne. And so there are only two various communicable diseases we talk about as waterborne or airborne. So either in the waterborne diseases, whether we talk about the typhoid, we talk about diarrhea, we talk about all those worm infestations, are all somehow related to the drinking water supply, with not be 100%. We know 60% of our sewage is being untreated and goes goes into either the ponds or the lakes or somewhere the contamination. We know how the sewage systems are in close connection with the drinking water with supply line and getting contaminated in the urban areas. We know how at the household level the drinking water is not kept in a proper way, and how we are not using our hand hygiene to not only before defecation and before eating, but the proper hand hygiene and hygiene sanitation is a key to the success. So I would request everybody to that the message has to not only in the terms of only those topics, but the deep down how and why, not only why, but it's how and the methodology has to be trained. So the practical trainings are very important. And so like I always tell my patients, I see every day so many patients, so I always give this message to them that just having a hand hygiene and talking about hand hygiene is not important. You should know how this hand hygiene works, and how are you going to kill it, and what is the methodology, because now the schools are closed, and at the same time, so when we are talking about public health, we are talking about this deworming days, we are talking about the nutrition days, we are talking about all those nutrition. The components of WASH are so eminent or so prominent that without talking about WASH, if you are talking about only health, you are missing the bus. And we will continue to miss the bus until unless both the WASH people talk about nutrition and both the nutrition people talk about WASH, and everyone has to talk about WASH. And until unless that is happening, we will not be able to succeed. Thank you. I think I have kept my points.
Thank you, Dr. Das. That was a very impassioned plea for improved WASH. And I think you touched upon many topics there, the relationship of WASH with health, with hygiene, and also with COVID. So thank you very much for that. We have one question from Dipinder Kapoor, which is, while we all accept that sanitation, water and hygiene and nutrition are interlinked, should we also discuss how important nutrition is in the poorest regions of India? I think this would be a question to all the speakers, but if you have any quick responses to it, we'd like to hear from you, Dr. Das.
Definitely, nutrition has got many aspects. The nutrition is not only through the WASH, nutrition is through the agriculture, nutrition is the food distribution, nutrition is through the health aspects. So all avenues has to be touched upon when we are talking about nutrition. So of course, but WASH is something which is direct correlation, which is into the hands of every individuals and in every households, as far as the hygiene is concerned, which and is the age-old concept, which we are not inventing the wheel. We are just reminding them that this is our practice, which has been for ages. Because if we talk about agricultural change in the nutrition, it's a huge topic which needs a lot of changes, which is to be there at the policy level, at the ground level, at our food habits level. So those are slower changes, but which is easy to low-hanging fruit. I always believe that low-hanging fruit has always been WASH. And so the interlinkage of WASH and nutrition has to be always been kept into mind, because even when we are seeing the midday meal programs, even when we are talking about the Anganwadi programs where we are giving home rations or the rations or the food for ready to eat food, the type of WASH facilities which are available in the Anganwadi while feeding or during the midday meal, the type of sanitation which has been properly managed, type of hygiene which is managed, is leading to a lot of diseases. Every day we hear about something or other because of the midday meal program. There is a sudden epidemic happening, sudden cholera epidemic happening. So the WASH is the foremost for our survival and the lowest and low-hanging fruit. And so the interconnection has to be always been kept in mind. But yes, nutrition as an overall with the different other aspects, whether it is agriculture, whether it is health, whether it is other avenues, needs to have finance, because it has got a lot of other aspects which needs to always be kept into mind.
Thank you. I'll move on to Dr. Benazir Patil and request her to speak. Dr. Patil is the Chief Executive Officer of Schools for Development. Dr. Patil, over to you, please.
Thank you, Nitya. I think Doctor actually touched upon the micro level aspects, and it's very interesting to hear from him how he connected the the wash related aspect, the nutrition related aspects, and how it is impacting health. Actually, for almost 2 decades, I have been working in urban areas and have been looking at urban health. And that's why I suggested, Nitya, that it would be great to talk about the macro level aspects, because what has been happening is it is very clear to us, when we look at any report or any document that has come as late as 2018, 2019. So 2 decades of 21st century, we can see the development that has happened in developing countries, including India. And there have been a number of policy drivers for urban health also. And these have largely been SDGs. Of course, before that, there were MDGs. We have, urban agenda, the new urban agenda, which was rolled out in October 2016 at Habitat 3 conference in Quito, Ecuador. And then, of course, we have our own national health policy that talks about wider determinants of health, which is focusing on air pollution, better solid waste management, water quality, road safety, vector control, reduction of violence, and other things. Now, let us understand one thing here, that we all agree, we all understand that, before COVID also we were talking about urban situation, urban poor, urban scenario wherein things are not functioning well. And in COVID, it has highlighted much more, because we all realized that the urban localities, the urban geographies were very, very, what you say, vulnerable. And though every single survey has talked about it, it has said that, urbanized locations show a lot of development. But when you compare them to rural areas, they are worst, because urban locations actually get masked by the good localities that are there in those cities. So, and we are at the moment expecting that urban areas, urban cities, they need to generate 70% of new jobs, contribute to about 70% of country's GDP. We are talking about urbanization as an opportunity. But at the same time, do we ever understand that the governance mechanisms, the infrastructure, the services that exist in urban areas are actually causing a jeopardy for the population staying there? For example, if you see, I don't want to get into very, very macro level, I mean, micro details of this macro issues, but just a very small example, like if you look at any of the governance mechanism that is constitutional in nature, we know that, the Panchayati Raj amendments have worked out and have been implemented so beautifully. But the moment you talked about 74th Amendment, which is about urban local bodies, every single state has, variation in terms of its implementations. For example, Maharashtra, Karnataka, Gujarat, you will see that the municipal bodies are really very strong. But the moment you look at UP, Bihar, or MP, or Jharkhand, you see that the municipal bodies, the local bodies do not have any strength, and it is still being managed by governance mechanisms which were as old as what they were 100 years ago or 200 years ago when we were colonized. So again, constitution is providing so many opportunities and so many flexibilities, but are the states willing to use them? Are the local bodies actually getting empowered? So this is a challenge when it comes to urban governance. And why I'm talking about this is that wash, nutrition may be very close to our heart. And what doctor also mentioned about it, we heard the challenges he was talking about, which are very, very practical, which are happening at our own homes, in our own localities where we are staying. But are we looking at the macro level aspects? Are we looking at the aspects that actually need to be worked out when it comes to, convergence or collaboration or coordination? There are many, many terms, intersectoral, multisectoral, that we are talking about. So, for example, if you see that there are many schemes, there are many programs, but all working in silos. Some of them I have listed here, whether it is Rashtriya Poshan Maha or Poshan Pakhwada. There's a National Council on Nutritional Challenges under Poshan Abhiyan. There's National Technical Board of Nutrition. There are so many advisory bodies. Similarly, for WASH, you have seen that we have the entire Swachh Bharat Abhiyan. We have the entire subgroup, which is of chief ministers, where they have to operate, where they have a governing council of Niti Aayog. It is chaired by the PM. All of these things are there, but at the end of the day, they are all working in silos. Now, for example, at the same time, we are at a juncture where we are seeing that whether it is wash or nutrition or food, any of these aspects are actually being impacted by COVID. So the moment COVID has impacted livelihoods, it has impacted almost everything, including the access to food and nutrition, including access to better facilities that a country would have put in if we were not so much forced upon to spend for our healthcare and health systems. Now, on one hand, there has been a complete discussion all the time that the health system is not prepared. We've never, geared ourselves up. Uh, the other school of thought is that the health system is pressurized. It's under pressure because it is overworking in COVID. And third thing is all the budgetary allocation, which we would have, logically had for health or nutrition or sanitation, that is all now getting dumped into one bucket. So where are we when we look at COVID? Similarly, yes, next. Similarly, when we look at several of these commissions or committees that have been created. So, for example, Poshan Abhiyan is there. Another is, something like Smart Cities Mission or National Health Mission or Swachh Bharat Mission. Actually speaking, none of these missions have refrained from coming up with some kind of intersectoral convergence mechanism. I'm saying they have not refrained. On paper, each of this mission has made it an effort to put up some committee where you can see that WCD, ICDS has to come together and work. You can see that the different sections in health sector, which is like vector borne or any of these diseases, have to work together. So there are many, many opportunities and platforms that are available, which are focusing on interministerial, interdepartmental coordination. But all of these are on paper and none of these have been activated. The biggest example is Poshan Abhiyan. And of course, one of the recent studies I was involved in, which was basically talking about, nurturing care for children of 0 to 6 age group. And interestingly, on the Ministry of Women and Child Development, the website, we found a national level council which was formulated in 2014 to work on these aspects. So I'm giving this example because every single ministry or mission has come up with this kind of approach, but unfortunately it has not come into practice. And that is why we don't get to see the collective outcome or the shared responsibilities that we should ideally have had. So one of the examples I'm going to talk about in this is a very recent example. It's not yet out in public domain, but I'm going to share this because that will give us a very clear idea of how an intersectoral or multi-sectoral convergence platform can actually function. So I remember sometime in 2018, we were working closely with Smart Cities Mission, and this was on behalf of World Health Organization. And there were various actors who were involved in this, whether it was development partners like USAID or UNICEF. There were bigger NGOs that were a part of this entire dialogue. There were missions, especially National Health Mission was also there. There were ministries that were coming for the meetings, and it was one effort that the Ministry of Housing and Urban Affairs was steering. And the whole idea was that whether we can bring in a multi-sectoral, multi-dimensional approach.
Benazir, your audio has gone off.
Sometimes. Is it better now?
Yeah, can hear you.
Yeah. So we were in in-depth discussion on how do you bring or how do you make a difference to either wash or nutrition or any other social determinant to impact the health. And there was a very intense thought process, and an outcome that actually we worked on at that time, which is now coming in real time, is the mission director of Smart Cities Mission proposed that do we have a mechanism within our country? We have lots and lots of data availability on different platforms. We have lots and lots of programs working separately in silos. Do we have any such platform which can give what you say, a visualization of health of the city in one dashboard? So and the actual process began at that moment. So we went ahead, and this was all funded by WHO at that time, which is now almost complete. So we went ahead and met almost all the ministries at the national level, understood what data and record keeping they are looking at. Similarly, we went to state government departments. We looked at what were they custodians of, what kind of data sets. And the first exercise we looked at was about 30 to 40 different indicators of different social determinants, whether it was road transport, traffic, water, sanitation, hygiene, nutrition at different for different age groups, diseases for different age groups and for different stakeholders in cities and rural areas. We looked at different ministries that can actually talk to each other so starting from whether the indicators can talk to each other, and then going to the ministries and departments that look, your data can be correlated and it can be talking to each other. And so this process went on and on for almost 1.5 years. This was on even during COVID times. And today we have a dashboard ready where if, with a click, the administrator in the smart city, now this is being tested in few smart cities with an aim that this can go to 100 other smart cities, and of course to the smaller towns which National Urban Health Mission is kind of looking at. And there you can see in one click that how many road traffic accidents are taking place, how many sewerage systems that exist in the city are unfinished, are choked, are not being taken care of, how many what you call waste bins and other things are lying open, is there an open defecation that's happening in the city, what exactly is being given in terms of nutritional inputs for any of those age groups, whether and for any sections. Also, what kind of nutritional intake is there for people who are living in the city, who are not from vulnerable sections but are from middle class and upper class. And all that data, there have been efforts to generate new data, and there are efforts to look at the old data in the sense what already existed, And this all is going to collate itself and give you a visualization. So if there is a district collector or a municipal commissioner who is going to look at the dashboard of the smart city that he or she is into, will get in 2 or 3 clicks the linkages between different indicators of sanitation, of nutrition, of health, of diseases, of accidents, of addiction, and many more. So this has been the very first of its kind experiment, and I would say that if you are on the lookout, probably in about a month's time, this should be available for everyone to see in the public domain on the website of Smart Cities Mission. And at the same time, I will be in touch with Nitya. I will also share the links, because this is indeed one of the first kinds. Now, we don't really know whether this can be considered as interministerial platform, or we can call it something that is being contributed by a committee. But only thing we can say is that at least one ministry or one mission has taken the responsibility of steering it, putting it on the display, giving the ease to the administrators to take smart decisions, faster decisions. So that is what I can talk about this specific example. But apart from that, I would say that at macro level, all the interministerial platforms that are existing on paper, whether it is with Poshan Abhiyan, or it is with a National Health Mission, or is it with Swachh Bharat Mission. So each of these missions have a platform wherein these proposed stakeholders I mentioned here, like ministries, missions, academic institutes, autonomous bodies, civil society organizations, have to be a part of, but those are not activated as yet. So I wouldn't say that the key stakeholders or the administrators or the ministers have not thought through about bringing all of these, and make each other talk, make different ministries talk to each other. They have conceptualized it on paper, but in practical sense, those things have not happened. So I will kind of close this here, and I'll be happy to respond to the questions.
Thank you, Benazir. Very interesting to learn that there is this integrated database, and that's going to come up. It'll be, when it's fully rolled out, it's going to be a really powerful data monitoring tool as well as a decision-making tool. And I hope that along with that, the administrators also get some kind of capacity building on how to read the data, to analyze it, and then to be able to take decisions. I think it's really important that all this thing, if it's pulled together in one place, it's going to be a big step forward, for data-based, data-driven decisions, instead of the more ad hoc kind of thing that we've been used to so far. There are a couple of questions. I think Sophia Joseph has asked how we can advocate for better housing with families or individuals, so that they can invest in improved living, and building and maintaining houses. How can we advocate for the government to support societies and also with donors and companies to support housing infrastructure, so that there is overall improvements in WASH as well as food and nutrition security? So I think, this is a question to you, and I guess if the other speakers also would like to come in.
Yeah, a very prominent question. And yes, this is also being steered by the Ministry of Housing and Urban Affairs. And I think one aspect that I have learned with some of the ministries and some of the bureaucrats that are actually, managing or steering or, leading these missions, is they are very open to think tanks and the suggestions. And if we can operate this group that is today can operate as a think tank. And Sophie, if you can also, or the other experts can come up with suggestions on housing and improving the living conditions of people, it can actually go as an appeal or a proposal to few of these ministries. And these days it is even easier to follow up with them, because they do give time to experts like us who come up with certain practical ideas. Also, let me give you an example. Like one of the things that Smart Cities Mission has done is, about environmental aspects. So today there are several indexes that they have developed, whether it is living index or environmental index of every city, and what the stakeholders are saying. And I also feel that it is worth reaching out to them, because one of the things that is really appreciated of this mission is that every single smart city is looking at those aspects which are decided by the people living in those cities. So if you see, one of the things that we not fought with but advocated with smart cities mission was that overall health was always on the when it came to every single smart city, average out, health was the sixth priority. And when we reached out to smart cities mission that how come health can be the sixth priority, they said that it is the citizens who have prioritized these. So infrastructure is the first priority, transport is the second priority, sanitation is the third priority, and sixth priority is health. So it is not we who have prioritized it, it is the citizens. So we can actually look at a small section of certain cities, and we can speak to citizens on what they really want in terms of housing, living conditions, because that is something that we can reach out to some of these missions today. So I am not the I'm neither a policy maker or a policy implementer, but have been contributing to advocate for some of these aspects. So the best advocacy tool I feel is we formulate a think tank, we come up with the ideas and suggestions, and we reach out to the smart cities mission with those ideas, and they are always welcomed and worked upon. That is what I would suggest.
Okay, thank you. So I think that was an excellent kind of overview of what's happening in the urban space here, and also to understand how the various ministries are actually looking at health and other determinants. So thank you for that. I'll move on to our next speaker, Mr. Sujoy Majumdar, who is the senior WASH specialist at UNICEF. And he will be holding up the WASH banner, because our other speakers have been from the public health background, but like we've learned, there's plenty of overlap. So Sujoy, over to you, please.
Thank you, Nitya. Am I audible? Yes. So,
yeah.
Okay, Mitali is sharing the PowerPoint. Thank you so much for this, and thank you everyone for giving this opportunity. And thanks. It was very interesting to listen to Dr. Das and Dr. Patel on the various aspects. I think both of them highlighted the issues that plague our country while trying to look at WASH and its impact on nutrition and health separately, especially in terms of the government program. I'll just give an overview. I don't have a long presentation. I have around, I think, 8 or 9 slides. Just looking at first the linkage of WASH and nutrition, which Dr. Das and Achak Nitya had also mentioned very well, so I will not spend much time on that. WASH components under the MWCD programs for nutrition, which Dr. Patil mentioned. WASH in Anganwadi centers, which is basically one of the focus areas for UNICEF, and strengthening WASH in nutrition related programs, and what kind of work we are trying to do at the government of India as well as state level. And lastly, in the agenda, Nitya had mentioned UNICEF 3 state initiative we're doing called Swabhiman, and I'll just spend a few minutes on that. So if you go to the next slide, please. So Nitya has mentioned quite a lot of data. Some of it is here. He mentioned some more in addition. So 35% of all deaths in below 5 across the world is because of childhood underweight. And 50% of this is some way connected with some lack of wash facilities that we have globally. In India specifically, UNICEF 2018 reports to 118,000 children under 5 dying because of diarrhea caused by consumption of unclean water or unsafe sanitation practices. As you know, hand washing, I think Nitya also mentioned, critical in the COVID context. I mean, agencies like UNICEF have been and WHO have been trying to talk about hand washing for some time, but really we did not get an audience ever. And the COVID pandemic brought this into the forefront, and we are hoping that this will get in increased traction from the government as well as the community at large. It was interesting to hear Dr. Patil mention that in urban areas, they're saying that health is the 5th most important priority of the communities, and maybe that is where we have got. So we have failed in trying to communicate the problems that exist around the health sphere in India. One of the things that I really wonder is that why do we have so little focus on preventive health mechanism? If you go to the Ministry of Health's budget allocation, you'll see preventive health is a minuscule portion of the budget, and 1 or 2 officers here and there handle preventive health. I mean, it is all, the whole focus of our health system is on curative health, because that's where the money is. And unfortunately, we have not been able to break that mold in the way we look at. So if you see Val Curtis and Sandy Cranecost in 2003 paper, based largely out of India, says washing hands with soap can reduce the incidence of diarrheal diseases by 40%, and I'm sure major decrease in the spread of infectious diseases. Dr. Das can possibly give more data on that. But what I hear anecdotally is from Africa in the Ebola pandemic in West Africa. The thing that really managed to bring that outbreak under control in 2017-18 was hand washing practices by the health staff and by doctors. You see, doctors themselves in hospitals were not washing their hands when between patients, and so this is it's not rocket science, but the problem is on practice, and that is where I think we need to look at. The next point, Val Curtis again, hand washing. This can you go back 1 second, please? The earlier slide. Yeah, hand washing decreases respiratory infections by 16%. This is pro-COVID. We do have research is happening now, and hopefully in a couple of months we'll be able to bring out data on the fact that how does hand washing impact the spread of the COVID pandemic by actual figures. Now, I mean, there is research happening. We do have arsenic water levels. I just want to point out one study that UNICEF did with the Shriram Institute in 2018-19, which showed that communities which had 0% open defecation, means all household had toilets and there was no OD in the community. Those communities, we saw that the groundwater and the surface water levels contamination by various human and animal origin bacteria, it goes down by almost 50%. And this study is available in the UNICEF and the SRI websites. You can have a look at it. And it was one of the studies which actually influenced the government in thinking about going for Swachh Bharat Mission phase 2, when they said that it was really making an impact. Fluorosis, as you know, of course, is a public health problem. It's a nutrition issue. So there were other information, but there was one slide I removed. The question is, I don't think there is any doubt that consumption of safe water, safe sanitation practices, at the household and the community level, and adoption of safe hand hygiene is critical for preventing the spread of infection and disease. And I think this has to be understood not only by the community, but also by the administrators who are implementing programs. Next slide, please. I'll just go through this quickly because I think Dr. Patil mentioned a bit. We do have the Poshan Abhiyan, and the Poshan Abhiyan guidelines right now looks at promoting hand washing, toilet use, talking about working with Anganwadi workers on use of sanitation facilities and on hand hygiene, looking at diarrhea, hygiene, safe water and sanitation as one of the key messages of Poshan Ma. So as was mentioned earlier, the Poshan Abhiyan, when it started a couple of years back, I was personally enthused by the initiation. This, I think, a campaign started in Gujarat by the Honorable Prime Minister. We were hoping it will move on the direction of the Swachh Bharat Mission. Unfortunately, I think we got hit by COVID very badly, and the Swachh Bharat Mission could not, I mean, the focus of the Swachh Bharat Mission could not be focused in the Poshan Abhiyan. But that does not mean that we don't continue working at it. So this is something we really need to look at. One of the areas we are working is on Anganwadi centers. You know, the Ministry of Women and Child Development has over 14 lakh Anganwadis functioning in the country. About half of it is on private buildings, which is a major problem. Private buildings have half of it, and government buildings have the other half. Government buildings have, to a significant extent, safe water and safe sanitation facilities. Private buildings do not, and the government does not want to spend on infrastructure in private buildings. It's a major roadblock. So we're trying to work with government to work around that. The Jal Jeevan Mission, we're trying to work with them to give piped water supply to Anganwadis and to schools where young children go, and make sure that the sanitation facilities are functional, they have water supply, they are clean. But as you can imagine, there are issues. I don't know how many of you saw recently, there was an article in the newspaper, in the media, of a UP Teachers Association wanting leave from government because the schools in their schools did not have clean latrines. And they said, because we can't go there, so we want leave. So even after all the effort, there are huge gaps, mainly on operation maintenance issues, not so much on infrastructure, but on operation maintenance. That if you build a facility, if it is not maintained, then so who is responsible for that? Everybody pushes the buck to the other person. The school pushes the buck to the sanitation department or the Panchayati Raj department. The Panchayati Raj says we don't have the resources to manage it. School does not have resources. The education department or the women and child says we don't have operation maintenance resources. So we really have to get our priorities right. Unless, as you correctly mentioned earlier, unless you have clean hygiene and children follow clean hygiene and clean sanitation practices, then all the midday meals will actually result in a problem. So that is the thing that really we need to look at. Then the new concept of a couple of years back, the Village Health, Sanitation and Nutrition Day. I think it was a very good attempt at multi-ministerial convergence that was being spoken about. We need convergence. But for me, this convergence, I don't see it happening at the Government of India level. I really heard intensely what Dr. Patil had to say. But my experience with government, having been in the Ministry of Jal Shakti, the erstwhile drinking water and sanitation, I feel that convergence at the macro level in Delhi is one of the hardest things to achieve. I don't know, I'll draw your attention to two examples on this. One, when I was in the sanitation and the water program, we used to get this monthly integrated disease surveillance program report from the Ministry of Health. Like the IDSP report says that in this month, in these days, there was a cholera outbreak in, say, the waterlogged areas of Assam, right? Now, ideally, the water and sanitation department should immediately look at that figure, go to see whether the water sources in those areas are contaminated or not. and then send those reports back to the health ministry. There has to be some kind of convergence. But on the but at the national level, there was effectively nothing. And all efforts to do that has really not borne fruit so far. The other example I'd like to say is an initiative by the finance minister in the budget of this year. If anybody of you had really followed the budget closely, there was what the finance minister called health and well-being across communities. And she said that she is going to allot 215,000 crores, if I'm not mistaken, to look at health, water sanitation, nutrition, and vaccination together as a convergent allocation. That is a very good idea, but if you look at the way it's being implemented, there's plenty of, absolutely every ministry is working with silos. And I'll also say that, of course, for the first time, the finance minister allocated 64,000 crores for public health spending, which we hope includes preventive health across 6 years, 10,000 crores a year. It is significant money if only it is used properly. The problem here is public health is with municipal corporations or with panchayats. It's not done by the health department. So the health inspector of the municipal corporation is responsible to ensure public health in his area. And their approach to it is just spraying DDT spray once a month when the rainfall falls. So, the whole concept has to be broad-based to make sure that the people who are vulnerable are prevented from from falling sick. And all interventions needed for that has to happen. That has to look at water quality verification, cleaning of dumps, make sure waste is not disposed here and there, controlling of stray animals, as was correctly mentioned by Dr. Das. So huge kind of work. The view of the municipal corporation has to change completely in the view of what is looked at public health and preventive health. The village. So my request is that what UNICEF has been trying to do is to work at the field level, get the collector on board, as I said correctly, to say that you need to converge the ground level or municipal corporators, that these departments need to work together. And the village health sanitation day has worked well in rural areas. I'm not sure about urban, but this is a convergence that have to go in. Next slide, please. I'll just go through very quickly this slide. I won't read through the whole thing, but UNICEF, our focus has been to strengthen the gaps in Anganwadis. Look at Anganwadis, look at the wash facilities, hygiene facilities, see if there are gaps, make action plans, help the panchayat or the department to quickly make action plans, and then get that action plans funded and implemented so that the young children and the mothers who go there at least have access to safe water, sanitation, and exposure to hygiene, and about vaccination, and about immunization. There's so much we can do to communities. Reach out to women, tell them that you need to get your child vaccinated and immunized in time. The immunization program actually got hit a bit because of the COVID pandemic. It's now slowly returning back online. But there are issues. I think correctly I've said it's better in rural than in urban. I think urban it's each person on its own. So there has to be more focused planning and attention on that. Capacity building and sensitization. I'll just mention one point here is that this hand washing initiatives, there is a huge hand washing need now. And partners present in this meeting are working together to try to talk to 6 ministries and Niti Aayog and Cabinet Secretariat to put a hand washing action plan in place. And I just want to say that the response from the government is dead silence. No ministry wants to do it. The only ministry which has responded a bit is the Ministry of Panchayati Raj, but Ministry of Urban Development, Niti Aayog, Health, Women and Child, Education, and Jal Shakti has been dead silence. So sensitivity of the government officials is still missing. And the Swachh Bharat mission got into place because of the Prime Minister's push. Otherwise, I don't believe that the bureaucracy would have done it. So it is for advocates and for opinion makers to really work on this and create awareness. Next slide, please. I'll just quickly go through, give you an idea of this. This is a Swabhiman program, which UNICEF is working with 3 state governments. The idea of this program is to improve women and girls' nutrition through systems and community-based approaches led by women collectives, SHGs, and we are getting comparatively good response from communities and from governments in this. So the idea was to develop programmatic know-how and convergence to involve community in nutrition sensitive and specific actions, including input of food, grains, agriculture, the way dietary patterns, and one of the factors there was wash. So I just wanted to highlight this. The package was that they should improve food and nutrition intake, micronutrient deficiencies should go, and anemia should be controlled. The increased access to this village health, sanitation, nutrition day services. One of the major inputs was increased access and awareness of wash services. And last one, preventive, early, poorly spaced and unwanted pregnancies, and a multi-departmental convergent approach, just like was been mentioned by Dr. Patil. So this has been going on for the past 5 years. Next slide, please. 3 states, Bihar, Orissa, and Chhattisgarh. 4 districts, 5 blocks, 356 villages, 6. So around 150, no, back please, direct beneficiaries, young girls, adolescent girls to come in to the program. Newlyweds, pregnant women, young mothers. And then collective institutions, SHGs were there, village organizations, cluster level federations, and farmer groups. And basically our WASH intervention was that awareness generation and getting SHGs to make sure that every household has safe water, has safe sanitation, and practices safe hygiene to the extent possible. Menstrual hygiene management, solid waste, liquid waste within households are also essential components. So we have managed to do in 356 villages. Next slide, please. And we are getting very good results. The girls are coming together, young ladies are coming together, planning, assessing, budgeting. They are getting convergent budgets from the panchayat and from the administration, analyzing, and then action interventions. As you can see this. So for WASH, the idea was basically to identify the problems and then support each household through SHGs to make sure that they have appropriate facilities. Nutrition and health interventions are also there, as is mentioned in this slide. Next slide, please. So one of the lessons learned, so this is not WASH specific, but one of the things we thought that we must involve the community. And once you give responsibility to the communities, we see that the result of the interventions become much better. And capacity building of the community was one of the first things that was done. NGOs were involved to do all this, and hand-holding these SHGs to make sure. One of the very interesting intervention I want to say, because Dr. Das mentioned it, that latrines being built in incorrectly built toilets. That is true in many places in rural. This was more rural than urban. But what these SHGs were told that you need to repair your toilets and make them safe, and to do that, the SHGs were provided resources and orientation training of the masons, and the SHGs came forward and got their own latrines completely retrofitted. They also constructed bathrooms where they did not have for privacy. So significant improvement happened, and this is still on, it's not yet over, and a complete ecosystem change we're seeing. And many of the collectors are extremely happy with what they are seeing, and they are trying to upscale. So one of the things, last fourth point is, we don't rush processes. Don't think that just impose something from the top, it will happen. Give the community the chance to think it out, plan, and be a part of the process. And then identify and nurture champions from within the system. One of the issues that I think is coming out very clear, that external imposition of projects is not going to give us anything. We have to get participation of the local community in the management of the process if we want to get sustainable results. So I stop here and over to you back, Nita, for any further interaction. Over.
Thank you, Sujoy. It was really interesting to see how the various nutrition programs are also now bringing WASH increasingly into their ambit. And there was a time, of course, when it was just nutrition, it was about supplementation and all of that kind of thing. And there was no mention of water, sanitation, hygiene. But now increasingly it is finding its way into the lexicon at least, and hopefully it will find its way also into the action. There are a couple of questions and comments, Sujoy. One is from Vijay Lakshmi, that a lot of the nutritional deficiencies also come because of pollutants and that have actually crept into food through adulteration. And do you think it would make sense to involve the Ministry of Consumer Affairs also, in improving nutritional outcomes? And then there's a second question from Sophia Joseph that during the lockdown, the last year, children have been at home, and it's been a big challenge to provide them food material, especially midday meal services, and also education and awareness. So how can you actually improve that given the current situation?
Yeah, thank you, Nitya. So the first one, so I'm not a food expert, so I really cannot comment directly on that. But one of the things is absolutely, I think Consumer Affairs or even FSSAI, we really need to engage. We need to engage. See, one of the things that we have observed a bit, again, I'll say that UNICEF is more of a rural area-based organization. One of the things we are absolutely amazed to see is the marketing capacity of fast food companies even in rural areas. I mean, where you do not get clean drinking water, you will find Uncle Chips, and you will find Coke, and you will find Pepsi, and you will find all kinds of fast food products available there. And definitely one of the issues is how do we make sure that the consumption of food is of nutritional, the nutritional values are maintained, and so engaging with I don't know how much Consumer Affairs can control what these guys are putting into their food products, but engaging with them surely is important. And I think also with FSSAI we should all engage and make sure that they are aware of the problem. That is one thing. The other issue about the COVID blockage and the fact that midday meal was given to households, there has been a research done by one of our UNICEF sections, and they have found a significant impact of COVID on the midday meal food distribution and the quality of food and the uptake of food that is reaching homes. In fact, I would want to say that last week UNICEF globally appealed to all presidents and prime ministers of the world to immediately reopen schools. They are saying we are now going into schools have already been closed for almost 18 months now, and looking at the data about young children falling sick, it makes no sense to keep them away from schools anymore. We have to bring them back, and one of the reasons of that is not, of course, is of education. That is one primary reason, but the other reason for small and middle income countries is of nutrition, is that it is affecting the nutrition of children and also mothers. So we really need to look at that. We have worked with the Ministry of Women and Child, trying to ensure that every child gets the Poshan Abhiyan food and the midday meal food, but it is difficult. It is difficult, and we are hoping, we are seeing indications. Some states have started the schools back again. In fact, what they have done, like I know states like Bihar or Jammu Kashmir have started from class 10, 11, 12. It should actually be the other way around. UNICEF is saying you should start from class 1. Get class 1 to 5 back first, and then get the senior classes back. The young children are the ones who are safest from COVID. Let us bring them back. Otherwise, its nutritional and educational impact will be significant. Delhi government is one which unfortunately is stubbornly refusing to hear. We have been requesting the government here in Delhi that please reopen schools, and we are hoping for a response. But right now, what they have decided is schools will open in 2000. Will not open in the current year. So, yeah, I stop here. Over.
Okay, thank you so much, Sujoy. I think those were excellent insights. I'll now turn to our last speaker, Dr. Rajesh Kumar. He's just been able to join us. He's the Executive Director of the State Health Research Systems Resource Center in the Department of Health for the Government of Punjab. I won't spoil the surprise, and over to you, Dr. Rajesh Kumar, for your presentation. Thank you.
Good afternoon, everyone. Hope you can hear me.
Yes, loud and clear.
Yes, sir.
Okay. So I will expect that organizers will show my slides. I had sent slides to you. Will that be possible?
Yeah, we'll just put it up, sir.
Just putting.
Okay, first slide, please. Okay, so my talk is going to be on, relationship of wash and many other factors with undernutrition among children. And in the undernutrition, I have chosen one index, which we call stunting, which is short height as an indicator of undernutrition among children. So this means that children are not attaining their potential height because of the undernutrition. I can't see the slides. Can you show the first slide?
Nitya, this is Sanjeev here. I think I've been informed by Mitali just now that she, until now, she was the host, but probably for some technical glitches, she's no longer the host. So a bit of an issue here. So we'll request the speaker to just wait for a while, maybe around 30 seconds. And in the meantime, I'll request my colleague Chetali to please make Mitali the host so that she should be able to put the presentation up. Thank you.
Okay.
I'll see, maybe I can try doing that while we wait. Okay.
I can
It's
see now.
up, and I'll just switch to.
Can you make
Alright.
it full screen? Can you make it full screen?
Full, yeah.
Yeah, it's full screen. Can you see this?
No, Nitya, this is not in the presentation mode. So probably
You will have to click the presentation mode down there. Yeah.
I clicked
I
that.
am the host now. I can share if you want.
Okay.
Okay, fine. I'll stop this.
Okay.
Go ahead, Mitali.
Oh yeah. Now it is there.
Thank you, sir.
Okay. Thank you very much. So as you were discussing earlier, childhood undernutrition, and we have taken this like stunting, is a multifactorial issue. And UNICEF has given this framework to understand how various factors interact and are responsible for stunting. I would say this is a very simplified diagram. The world in which we live is very complex, and many of these factors mentioned here interact with each other in a very complex manner. So if we see childhood stunting, it also is thought to be an intergenerational issue. Like women who have short heights, they have children who are low birth weight and also have short height. So nutrition is thought to be an intergenerational issue. This is one point. And then when we look at the immediate factors which are responsible for stunting, obviously, one thing which comes to our mind is inadequate dietary intakes. And on the other hand, is various types of diseases to which child is exposed. diarrheal disease, respiratory diseases. And these diseases affect the child multiple times during infancy and later years also. So a combination of low intake and more output, these nutrients, whatever child has taken, go out into the drain because of these various diseases which child suffers from. And then if we see another set of factors, this is intake is less because of less food in the household. And then inadequate care and inadequate awareness also. So health services are not accessible, available to people. And household environment is also not hygienic, as we were discussing earlier. Hygiene also plays an important role, sanitation and hygiene. Water is also one of the factor, and together we call it wash. And if we go further at the bottom, all these factors are intimately linked with socio-economic status, which is income and poverty, as well as the status of the woman, how much ability woman has to make decisions in the household. And poverty, income, and status of woman in turn depend on, our own socio-political economic system, which is actually the root cause. The kind of society which we have built, the kind of inequalities which we have in our socio-political system, the way we govern ourselves, the way we allocate our resources, that is the root cause. So this is the web of causation for undernutrition among children. And we try to find out what has happened to nutrition over last 20 years and what role these factors have played into it. And especially, for this presentation, our focus is on wash, water supply, safe water supply, sanitation, hygiene. So what role these factors play? May I have the next slide, please? Next, please. So we, at global level, some studies have been initiated to understand the factors which are responsible for undernutrition in various countries and in various states of our country also. It is very difficult to untangle this web of causation, but some effort has been made. And this shows that among many factors like poverty, fertility, agriculture, wash also stands out. This slide shows role of various factors in different countries, and there are 4 states of our country given in this. And in these analysis, what we find is that in India, this open defecation, sanitation, etc., they contribute about, in Odisha, it was about 9%, Chhattisgarh, about 12%, Gujarat, 9%, and Tamil Nadu, 16%. So this much was the contribution of wash in causation of. So we also initiated some studies to find out what is the role of wash. Next, please. So we have completed our study in state of Punjab, and we are also conducting this similar type of analysis in West Bengal, Uttarakhand, Telangana, and Andhra. If you see on the graph on the left-hand side, in Punjab, safe water supply has been achieved long back, and almost everyone now, more than 90% people, they get safe water. But the sanitation part has improved only in the last 20 years or so. After this total sanitation campaign was launched, we find that now Punjab has achieved quite a bit of sanitation targets also. And on the other side, you find the graph showing stunting. And this we have taken from National Family Health Survey, which started in the early 90s. And the latest survey has been done now recently, which has not yet come out for Punjab. The last survey which we have is 2015-16, and there is this another survey which UNICEF had commissioned, Comprehensive National Nutrition Survey. So what we find is around 2000, the decline in stunting started in Punjab, and it is going on until now. So what are the causes of this decline? What we were interested in this part, in this study. Next, please. And this is one analysis we have done, which we call decomposition analysis. That through statistical analysis, we try to find out the contribution of various underlying determinants. In the green you find is the contribution from wash. And when I say contribution from wash means the change which has taken place in wash in these 20 years, we attribute that change has contributed to the decline in stunting to the tune of about 13%. And this is improved sanitation. We have looked at the policies of the last 20 years, that which policies were responsible for this. Not only that we have done the analysis of the policies, but we also interacted with the policy makers, implementers at the state level, at the district level, and at the grassroots level also. So we find that the policies in the state, they were, although initiated from the center, but many initiatives from the state which were responsible for this. May I have the next, please? Next slide. Okay, so that was my my last slide. So we find that this has not happened on its own, but the policies of the state government and the central government have taken up sanitation and water supply seriously in Punjab and achieved the goal, which has contributed to decline in stunting. Now, you can say that, what was the pathway? One of the pathway could be decline in the diseases, which I mentioned, diarrheal disease and other diseases could be one of the pathway. Better hygiene, better availability of water. So these are the factors. So we need similar kind of studies to show that wash is responsible for not only for diseases, but for nutrition also. So thank you very much. And I would like to have, if you have any questions or any queries. Thank you.
Thank you, Dr. Rajesh Kumar. That was really interesting. And I think having these kind of large-scale surveys or analyses will really help to, underline linkages between wash on the other hand, on one side, nutrition and health on the other. There was a question early on in the session. You weren't there, from Deepinder Kapoor, that while all these, we all accept the principle that all these factors are interlinked, how important is nutrition in the poorest regions of India? What is the evidence from there that that wash and nutrition are linked, and how important is nutrition in rural, especially in rural parts of India?
See, nutrition is important. Nutrition is linked with morbidity and mortality, and the working capacity. So, nutrition is one of the very important determinant of quality of life of humans, and it has been included in the SDGs also. But unfortunately for us, we were a nutritional insecure, I would say, civilization for a long time. The famines and the epidemics used to raise this land for a long time. It is only after independence that we have now the frequency of epidemics have declined and some nutritional security has come to the country. So this long periods of deprivation, really if you see in the poorer parts of the country and poorer sections of our people, there, if you measure, their weight of the woman, you will find, people living with, 25 kg weight, 30 kg weight, and you see their heights, So this is a result of both that lack of nutrition, because of arrangements, the kind of living arrangements they have, hygiene, water supply, sanitation has been really very, very bad. There was hardly any sanitation existing in the rural area. Although we are a very ancient civilization, our ancestors in the Indus Valley, they had established, sanitation systems. But somehow, over the years, all that was lost. And water supply, as you see in the civilization, most of the cities are near the rivers or near the sea. Water is such an important source for human life. You all know that 60% of human body consists of water. So when populations, with the pressure of population started moving inland, every village has a pond. That pond is source of drinking water as well as, all the wastewater goes into it. You see. And when people started making wells, they were very shallow wells. The same shit will come to the well, which they will discard in the morning. So this fecal-oral transmission, and that cholera is home. India is the home for cholera. And when cholera spread all over the world and it went to the England, then, they discovered this water is responsible for cholera. You see. So it was so much intimately related, you see, that nutrition and hygiene is very much linked, and nutrition is so much important. And it has become like an enigma in South Asia. Even nutritional status is better in African countries as compared to us. About 25 years ago, one of our scientists, Professor Ramalinga Swamy, he was professor at AIMS, and then he was director general at ICMR, and then UNICEF also commissioned some report on nutrition. He's written a small piece there in 1995, I think. He's titled it South Asian Enigma. And he has also pointed out that perhaps other than many other factors, the low status of women in this part of the country, part of the world, is also responsible, because women have very, very low status here, and they are the decision maker. They are the ones who rear the child. You see, so it is multifactorial actually. So many factors intertwined into it that no progress, not worthwhile progress has been made in India in nutritional front. This project Ocean is also not making that much as the goals it has set. These 4 or 5 states which we have selected, these are basically because there is so much negative negativity about this sector, that nothing is improving. So what we thought is, let us find out of 36 states, are there some islands where some improvement has taken place? So these 4 or 5 states we have found out where stunting has declined in the last few years. And then we thought that why this is declining. You see, and if these things can be replicated into other states. So this is my answer to this question. Thank you.
So there's another question for you, Dr. Kumar. How is the study methodology in Punjab separated the wash impact on stunting from poor nutrition impact on stunting? Is there separate data, or is the impact of individual wash? What is the impact of individual wash factors on stunting? So would you like to answer that also, please?
Yes, actually, National Family Survey, they ask questions on wash, sanitation, water supply, hygiene, etc. And they also ask question on nutrition. So we had these data sets to begin with. And from these data sets, we have seen the change in these factors, wash factors, and then change in the nutrition. Okay, so both the changes we have. So generally, what people have done is that cross-sectionally, they have found association of safe water with morbidity, with mortality, with nutrition. These are cross-sectional studies, right? So nobody had done that. If there is a change in these underlying factors, how much is change into the nutrition? So now there are special statistical methods where you can, because all these factors, they work together. It is very difficult, like women education is there, like health services are there, preventive services are there. So all these things are simultaneously affecting the nutrition of the child. So how to separate out? It's a very difficult question. We can't have experiments conducted that you change one thing at a time and then see the effect of it. So in whatever is happening naturally, so we use statistical method. Some statistical methods, they give us independent effect as compared to other factors. So this is called decomposition analysis, that we try to find out that what is the contribution of each one of these factors in a way that if other factor was not there. So this is like if total variation in the data, we could explain only 75%. 25% we don't know, because everything is not measured in these surveys. Like women autonomy has not been measured. You see, so whatever we could see is 75%, and out of that 13% we could see is the contribution of wash. There was a big contribution of income also into this. Although the health department wants to take all the credit, you see, when there is child mortality decline or maternal mortality decline, they want to take the credit for everything. But it is not so. So many other factors also at the same time influencing morbidity and mortality and nutrition. So this is a statistical method which we have used here. Hope
Okay,
I
thank you.
satisfy.
Yes, yes, thank you. Sanjeev Jha has his hand up. Do you have a question, Sanjeev?
Yeah, I have a question. I thought rather than trying to compose it in the chat box, if I would just get about 30 seconds to ask this question. Dr. Saab, I have a question. Like when we look at the NFHS 4 and NFHS 5 data, then I'll just take into account only one of the indicators which relates to the childhood morbidity. So the prevalence of diarrhea in the 2 weeks preceding the survey, it is showing a decline. I mean, no improvement. But if you look at the, along with it, I think several other child morbidity indicators are also showing a decline. and I put some information in the chat box. I'm not going to repeat that. But my question is that how come that the morbidity data is showing a decline, but the overall under 5 child mortality is showing slight improvement? So how can we explain that?
See, in NFHS as well as other data set which come from the sample registration system, the India has shown consistently a decline in infant mortality and child mortality, and has achieved MDGs also. So now, then the question is that this decline, so we see the cause specific mortality. What are the causes which are declining? So we see a big decline in diarrhea related mortality among children. So, and second, we see very big decline in respiratory infections also. Okay, so we see that these diseases. Now, next question is whether this diarrhea specific mortality decline is because of the better treatment, or is it that diarrhea has declined itself? You know, I think both the things have happened. The treatments have improved, and as well as some decline in diarrheal rates have also gone down. This NFHS data also show. But NFHS data, one problem is that these are cross-sectional studies. So they see only in the last 2 weeks. And it also depends when they conduct the survey, different rounds. If they conduct the surveys in the diarrhea season, then it will be more as compared to others. But I think another source of decline in diarrheal diseases is outbreaks. That the number of outbreaks which IDSP records, the number of outbreaks which used to be for diarrhea has slightly gone down. And food poisoning has now become #1 outbreak in the country. Earlier it used to be diarrhea, #1. So maybe both the things have happened. Okay.
Thank you so much, sir. So insightful. Thank you very much. It was a pleasure listening to you. Thank you, sir.
Thank you, sir. Sujoy, you had a question or was it a comment?
No, it's a question.
Yeah, go ahead, please.
Thank you, Doctor. I think it's really interesting to hear your comments. Two.
You're not audible.
Slightly less audible. So
yeah, can you hear me?
Yes, sir. Now.
Is it better? Okay, Doctor, thank you for this. 2 questions from my side. One is that the drinking water and sanitation department in all states have set up water quality monitoring laboratories at the state level, district level, as well as I think in many states and sub-district level. If I'm not mistaken, Punjab has a very high-tech laboratory at a state level, looking even at heavy elements because of the problem of cancer. But my question is there any linkage between the water contamination data that these water quality labs are getting and the incidences of outbreaks that you mentioned that you may have observed in the state of diarrhea or other diseases? And if not, do you see this kind of sharing of data and cross exchange of information important for the management of these cases? That was question number 1. My second question is basically, it's not a nutrition question, is are you also looking at research on the impact of hand washing on the spread of infectious diseases like COVID? Over to you. Thank you.
Yeah, I think the Punjab and like many other states, water surveillance, water quality surveillance, the engineering department, they do it. Health department does not do that much. Okay, and there is a lab and which is doing it. They do it microorganisms, and as you mentioned, increasingly they are also beginning to do this chemicals also. As far as outbreaks are concerned in Punjab, every year we see some outbreaks of diarrhea. Some of these are related to food poisoning, and some are related with this mixing of the sewage water in the drinking water. Because of the breakage of the pipes or overflow of the sewage. We see, and these are the diarrheal diseases as well as, hepatitis. And large outbreaks we have seen in the urban areas. Because these pipes were laid down in the British time, sewers were constructed at that time, capacities are now, capacity need to be increased and repair, etc. And so the problem in this sector, you know it better than me. Engineers know it better than doctors. Let's say capital intensive. We have seen outbreaks in various towns and cities. Every year we see in one town or the other, and sometime in the villages also. And this is both doctors and engineers are at loggerheads. Doctors say that this is your fault. You people don't do it properly. And so somehow the sectors, they operate very separately. And in the total sanitation campaigns, Swachh Bharat, etc., whatever are there, health department think, it is not their domain. Whereas they are there, they have the presence at the grassroots level, and for education, etc., as you say, hand hygiene and many other things, for advocacy, raising demand, they can play an important role. But both the departments, water supply and sanitation, is a separate department in Punjab. So there is not that much of coordination, but I do agree that there are outbreaks related to it, hepatitis, as well as other diarrheal diseases. And this is, and then maintenance of these water supply systems, particularly in villages. We many times find that there is one employee there who is not very well trained how to mix chlorine, chlorinate it, and etc., etc. So ownership of the local communities, maintenance management. Sometime, in frustration, I have made some comments in the meetings under frustration that this piping systems have compounded the problem. If there would be an outbreak in one village now, because the water supply is going to cluster of villages, so one infection from one broken pipe, spreads to now more number of villages. You see, this kind of problem we sometimes have.
Thank you, Dr. Saab. Mitali, you had your hand up.
Yes. So, Doctor, I would like to ask you a question. Are there evidences to suggest a correlation or association between wash provisions and COVID treatment outcomes?
Yeah, actually, we were, to begin with, we were very much concerned about this, that, spread of COVID, is through the droplets, and the droplets have water. You see, so it's water related problem, water associated, I would say. So droplet, but, droplets fall on surfaces, and so surfaces also can, be a source of infection. So initially, to begin with, we had a very, very big campaign for this hand washing and use of sanitizer, etc. But I will not be able to tell you that we did not do any study as such that, this modality of hand washing, how much it was responsible for spread or for prevention. Because all the modalities of mask, distancing, everything has been going on at the same time. So we did not find any such opportunity to investigate that, there was an outbreak specifically. We can say that this was related to lack of hand washing, etc. Okay, but it does play in respiratory infections. 10, 20 years ago, we never believed that, this type of spread of respiratory infection can take place. But now we know that some amount of spread can take place from the surfaces. So hand washing, even for respiratory infections, is important. Earlier, it was important only for diarrheal diseases, etc. Okay.
Thank you.
Thank you. So we're almost at the end of this. If there is any last question from anyone in the audience, we can maybe take one more and then we'll have to wrap up. Okay, I guess there are no more questions, in which case I think we can wrap up the webinar here. I think we've had some excellent insights from all the 4 speakers on different aspects. Dr. Ashish Das talking about the linkage between behavior and nutrition and WASH. Dr. Patil talking about a new dashboard which will actually help in database decision making and the various issues in towns and cities about sanitation, sewage disposal, and the WASH. And then Sujoy talking about the Poshan Abhiyan and saying how, and the campaign that UNICEF is doing, and how it has incorporated WASH in a very big way, so that there is true linkage, there are true cross linkages there. And then lastly, Dr. Rajesh Kumar speaking about the studies, the multi-state study that actually looks at large data sets and does its analysis to prove what the contribution of WASH is to malnutrition. And I think that is one of the clearest evidences that we've seen in recent times of the links between the two. So thank you so much. I would just like to say that the SuSanA chapter will also be initiating an e-discussion, a thematic discussion on this topic, probably starting from next week. And we will share the link for the discussion with everybody here, as well as on the SuSanA mailing list, so that you can participate. Eventually, of course, that will result in a synthesis document and also a policy note that we hope we can take up to the various ministries and have a discussion with them on the convergent actions that are required to bring the WASH and the health sectors together. So I'll end this here. Thank you so much to all the speakers. Thank you so much to the participants and to the India Sanitation Coalition team, Mitali, Chaitali, and Sanjeev, for helping with the entire webinar. Thank you.
Thank you. Thanks, everyone.
Thank you so much. Thanks.
Thank you.